Welcome to the meeting, June meeting. For the benefit of new members, a quick chat about what we are, what we do. We're here to help in any way we can and supplement all that wonderful treatment you hopefully will get eventually for some via the NHS and or private. Why we say we're there to fill the gap because there's a huge gap. Some of you could wait literally years to get treatment and not know what's going on. Even those who get quite speedy treatment, they're there to treat your illness, your symptoms. They are not there, and they haven't got the time to tell you how to get on with your life. Um, and something, if you're new to a balance disorder, something many people just don't understand is how significantly your life can come to a standstill. One day you are fine, the next day you cannot balance, and that interferes with every aspect of your being. If you break a leg, at least you can get it set in plaster and sit down and forget about it for a while. Balance, even in your bed, if you move the slightest way, it's awful. And it's quite normal. I went through it myself 20 years ago with Meniere's along with all the physical symptoms come all the mental mind games, the fears, the anxiety. Am I like this forever? Is my life over? Um, and on top of that, even your most close loved ones will not understand. They can't understand. It's so difficult to understand why you look so well, but you some days just can't do anything. So we're all about trying to fix that. How do we fix that? You're all part of the answer because you're all becoming experts by experience. So you know what has worked for you, what hasn't worked, and we get to share with each other what the best way is to progress and the biggest thing to everyone to understand is, except for one or two conditions, most conditions, you will get to a much, much better place. It just doesn't seem it at the time. It seems very much like we're playing real life snakes and ladders, where some days are good, other days are awful. So, welcome to the group. We're all about, by the way, being positive. Even though we'll talk about some horrendous symptoms, we're always looking for ways, how do we deal with that? How do we cope with that? And the mixture is brilliant treatment, learning about your condition, learning about how to live with it. And the final bit, certainly for myself and many other members, has been getting that control in our minds to know that we are going to overcome this. We are going to live our life, and we're not going to be a tail wagged by the dog of our condition. We're going to be in charge of it. So lots to go through. We've got a wonderful expert speaker, someone who's supported us since we started 8 years ago. If you can give us a wave, Michaela. She's there. She's going to be talking very, very soon and telling us how we can do certain things at home with vestibular rehabilitation. The format is roughly, we should go on till about 2:30, 3 o'clock. Michaela will do a slide presentation and talk through all the good stuff. That will then take us to about halfway. I will come on and talk about a few news items just for a few minutes. Then we're going to go straight into Michaela's question and answer session, where we've got pre-submitted questions. But if you can be so kind, if you've got questions as Michaela speaks, type them into the chat. There is a chat facility on Zoom, and myself and the wonderful Claire Thorpe. Claire gives a wave. Claire is audiologist from the Royal Preston Hospital. We will monitor that for questions and then we will put them to Michaela later on. So now I'm going to hand over to the wonderful Michaela Burton. and let her tell us a little about herself and start the presentation. So everyone else, please sit back and relax. Thank you.
Yes, hopefully my screen isn't looking quite as liney as it is on my screen. I think I'm having a bit of a problem with my camera there, so apologies if my screen's a bit flickery. So I'm Michaela Burton. I'm also known as the Balance Lady. I've worked in the NHS for 25 years, left a couple of years ago to focus on the private work I do, doing the diagnostics at the London Road Clinic and also running the Balance Lady at London Road Clinic and in Ashby for doing balance rehab. I'm also trained as a clinical hypnotherapist and NLP practitioner. So that's neuro-linguistic programming, which looks at kind of the language we use with ourselves and the story we tell ourselves and the impact that that has on how we deal with things. So I'm going to talk to you today, obviously, about vestibular rehabilitation and things that you can do at home to try and help things and cope with things as best as you can in between, hopefully seeing someone that's helping you on the more medical and physiotherapy side of things. So let's try and see if I can share my screen. Bear with me. And hopefully that's up and sharing. Okay.
That's good. And Michaela, I don't, if you've got an external camera, it can be a loose plug that gives you
I've
that.
not, it's
It's
completely,
built in. Okay.
it's
Yeah,
in
it's
there.
good. Don't worry. It's as you know, the slides are big now, so it's not a
Oh, your
problem.
sound cut out then as well, which is, so let me know if the computer
Yeah,
starts going wrong, but it's, yeah,
will
sometimes
do.
it does it, but most of the time it doesn't. And it's unfortunately decided today's a very good day to do it just to keep things interesting.
Thank you.
Okay, so vestibular rehabilitation and self-help strategies. Now, it's important to actually be aware of what we're talking about when we're talking about balance. Balance isn't purely your vestibular function, your inner ear balance. When we talk about balance, we're talking about the equilibrium and the distribution of your weight in your body and in your surroundings. And this involves central processing, which is your brain being able to take all the information it's given, process it correctly, send out responses correctly, and everything responding accordingly. It's your visual inputs and not just in the how well you actually see, but how your brain is interpreting what's going on in your visual environment and your position in it. Obviously, your vestibular input, so that inner ear balance function, and what we call proprioception, so your full body systems, your musculoskeletal system, your nerves, your joints, all of that feeds information to your brain. So when we talk about balance, we're talking about all of those things. Often we use the word balance when we're meaning vestibular. So sometimes there's a little bit of an interplay between the two. The other key thing to remember, vertigo is a symptom. It is not a condition. So those of you that have been unfortunately told this is your diagnosis, you have vertigo, what you're being told there is you are experiencing a hallucination of movement. That's all that tells us. Vertigo is like the word pain. It tells us something without actually being specific about what we're talking about. It is important to know the condition, and it's not necessarily just one thing you're experiencing. So you can have Meniere's disease and BPPV, both of which are vestibular conditions causing vertigo, but they're not the same thing and they're treated very differently. So knowing what the conditions you are dealing with is important. Please don't be fobbed off with just you have vertigo. Very briefly, history of balance rehab, vestibular rehab. This is not a new thing. Many of you, I'm sure, are familiar with the Cawthorne-Cooksey exercises. It's often the sheet of exercises given to people by GPs and unfortunately some departments. That's the one where you're throwing a ball and you're doing all these kind of movements. It's of some use, but it is of limited use. Dix Hallpike, we use that when we're looking at BPPV. Things gradually progress to more customized approach to vestibular rehab as we get to Susan Herdman in the 1990s. But that's just brief history to show you how long this has been going, and also how long it's taken, unfortunately, for us to progress from a standardized sheet to a customized approach. Treatment of the dizzy patient is not nice and straightforward. It's not a one size fits all. We just do one thing and that solves everything. There can be the medical management involved, so the medications, potentially surgical interventions with some conditions, only some suitable for surgical intervention. Things like assistive devices, hearing aids can be very helpful. It doesn't tackle the actual vestibular deficit, but it can make things easier if you're hard of hearing to have a hearing aid, so your brain is having to put a little bit less effort into paying attention to your hearing, which gives it a bit more capacity then to hopefully deal with the other things it's dealing with. Walking aids, I'm sure many of you are very familiar with the walking poles and such things. Physiotherapy, which is where I come in, potentially Cawthorne Cooksey exercises, but the customized vestibular rehabilitation approach is by far and away the better approach. Psychological aspect of things does need to be taken into account. There will be a stress response for any chronic health issue. It's impossible not to. And as Kevin has said in the introduction, vestibular problems affect everything all of the time while you're suffering with it. So it can really knock your sense of independence and your sense of self. So vestibular rehabilitation is making use of the natural way that your brain can adapt. This neuroplasticity it's called, and it's your brain can learn if it's given the information that it needs. Now, we can't undo any damage that's caused to the vestibular system. It's about training your brain and creating new neural pathways in the brain. And the only way we can do that is by exercise. So essentially, I can't make you better, but I can tell you how you make yourself better by giving you really good guidance and support. Now, certain conditions aren't necessarily typically helped fully with vestibular rehab. BPPV, when the crystals are moving, we need to do Epley maneuvers or other such repositioning movements to reposition those. The balance exercises won't help BPPV when that's active. Migraine, it's not the vestibular system there, it's the brain, and it's a case of tackle the migraine itself rather than potentially the symptoms it's causing. Meniere's disease, vestibular rehab exercises are not going to stop or help a Meniere's attack, but we can help any imbalance in between. And certainly with things like Meniere's disease, the timing between the attacks potentially will have a big influence on how much help we're able to give with vestibular rehab, but there is help that we can give rehab-wise with these conditions. And there's a lot of other factors involved in the gradual recovery of vestibular function. Psychological factors have a big impact. Fear is a very natural response. There's been many studies that have shown, though, that a fear of falling unfortunately increases the likelihood of falling. We change how we move, and that then can cause further imbalance. There's a very good program I saw on, I think it was Paramount, with Chris Hemsworth did a series called Limitless. And the first one he did, the first program he did that is based on stress. And there's so much on that I was watching. I think this demonstrates so beautifully why people move differently when they have a vestibular issue, when the fear factor kicks in. So if anybody has access to that, it's well worth watching if you're interested in that. Unfortunately, it's not something I'm able to attach to this. Medication wise, that can have a big impact on how you progress with vestibular rehab. If you're taking vestibular suppressants, things like Stemetil, prochlorperazine, on a regular basis, that dumbs down the function of the balance system with vestibular rehab, we're trying to stimulate the vestibular system, so it can have a limiting effect. But do have a chat to your consultant, your doctor, or your therapist that's helping you with your rehab with regards to any changes or considerations with medications. Your own body's ability to keep mobile will have an impact. So if you've got severe arthritis, again, that's going to have an impact on how you're moving, how you're able to hold yourself, and that can impact on balance. Bed rest is generally a terrible idea. It will prevent compensation from happening. We need you to move to start to compensate. In an acute phase, absolutely, you're probably going to want to take to your bed, and with things like Meniere's attack or migraine attack, in the acute phase, you're probably going to be better in bed for a short time. But prolonged bed rest is going to bring in more problems than we start with, because not only will you have a vestibular issue, you'll start to get muscular deconditioning as well. So I mentioned before about the Cawthorne-Cooksey exercises. They have limited benefit, so something is better than nothing. And Cawthorne-Cooksey exercises are going to get people moving, which is great. That's what we need. What they are lacking is the focus on the vestibular ocular reflex, which is what we really, really need to focus in on to get the vestibular function working much better. And I'll come to the VOR shortly. So Cawthorne-Cooksey exercises, great for a short period, but as an ongoing treatment process, is of limited benefit. Now, I know many of you will have had a good look through the internet to try different exercises. And again, you can find things that are very, very helpful. And I'm not going to kind of discourage as such having a look to see what exercises are available that you could potentially try. But it's a bit of a shot in the dark as to what you're finding, whether it's actually suitable for you and your condition and your difficulties, versus the customized exercises that are given to you by an experienced audiologist, physiotherapist of whatever background we have, but those that specialize in vestibular rehab. We're able to listen to what difficulties you're having, work out what it is about those difficulties that's causing those difficulties, and come up with an exercise to directly tackle that particular thing. Whereas things like internet ones, you may randomly happen upon the one that suits you, you might not. So customized is by far the better approach to all of it. But the internet exercises and Cawthorne and Cook's exercises are helpful in the meantime, and if there's no other option, really, if you're really struggling in between. Vestibular rehab is not a quick job. I really, really wish I could say this was going to be quick and easy. It's not. It's a lot of hard work over a long period of time, and we can be talking months and months and months of really consistent repetition of exercises. This isn't doing exactly the same exercises for months and months and months and months. This is an exercise program, so gradually changing the exercises according to what you're experiencing, the difficulties that you're having, and the progress that you're making. They do need to be changed over time, but they need to be done. I advise people to do my exercises 4 times every single day, and they need to be spaced out. So this isn't a case of, right, I get home from work and I'll do all 4 blocks in one sitting just to get it over and done with. The brain learns best when it's given a little bit of information that it can manage, let it process that information, and then let it have time to recover from that information and have a rest. Come back to it again, give it exactly that same information, let it process that information, let it rest, come back later, exactly the same information. It will learn by far and away better that way, and doing it gently rather than trying to throw on a huge amount all at once and then leaving it at that. If you're going to the gym to build up your arm muscles, You wouldn't go straight for the biggest one that you could find, that biggest weight, lift it a couple of times and say, that's it, my muscles should be done. You start off gently and really repetitively build up until you can lift to the bigger ones and you're getting the muscles that you're after. And the brain is essentially the same thing. So the vestibular ocular reflex, if you do one vestibular exercise to get you started, this needs to be the one. And either with your thumb up in front of you in the middle or using any stationary object, as long as it's directly ahead and not off to one side. But I often get people using their thumb because they've always got it with them. Keep your eyes locked on your thumb and turning your head nice and gently, but nice and smoothly. Eyes absolutely locked on your thumb. Now, if you're going so fast that your thumb looks like it's jiggling around, you're going too fast. But equally, you don't want to go as slow as you can go. We want a nice steady movement. Ideally, do that for about 20 seconds, 4 times a day. What we're looking for with this is finding that point where you're doing the exercise and you're thinking, this doesn't feel that nice, but I can manage. And that's the level where we're stimulating your vestibular system and your brain, but not at the point where we're overstimulating it. If we stick with feeling perfectly easy and it doesn't have any impact at all, the brain's already dealing with that already. That's not going to change anything. We want that level where it feels a little bit odd, but manageably unpleasant. But 4 times every single day. So moving away a bit from the more guided vestibular specific exercises, things that you are able to do at home yourself in between either seeing a professional or in the lead up to whilst you're waiting for an appointment. So I appreciate certainly with the NHS that the waits are exceedingly long and it's very difficult to find someone that's suitable to help you. But we are out here. So basically any physical activity will help, even if it's just to start with, just moving your head a little bit, doing the VOR, doing these things little and often and gradually increasing will make a massive difference. And this is why the advice of bed rest is one of the worst things that you can do. Avoidance, although it's a natural response and it's your brain's way of trying to look after you, it's the worst thing that you can do. The brain needs that information, so we need to stimulate it. We need to move. And as I say, little and often is the only way to do this. Walks are fantastic for everything. But again, on a regular basis, even if it's just up and down your bedroom or through your living room and your hallway, up and down the garden, you can gradually build up the distance that you're covering for how long you're walking. But walking, you're stimulating your vestibular system, you're exercising your muscles, you're getting a bit of fresh air if you're getting out and about. It's brilliant for mental health. So it ticks an awful lot of boxes. So daily walks are really, really strongly advised. Tai Chi is a wonderful thing. You can do that by online. There's various people online that do Tai Chi classes in your local leisure centre or adult education places often seem to have it as well. You can do seated Tai Chi. It doesn't have to be a standing one. For those with limited mobility, there's a lot of classes that are tailored to you. As I say, doing them seated is perfectly good. But any activity that you enjoy doing, whether it's football or whether it's as I say, going out for a little walk, just taking your child down to the park and not even necessarily moving about too much, but just that little bit of walking will make a big difference. But finding something you enjoy doing makes it an awful lot easier to do on a regular basis. And that really does make a big difference. Nobody wants to do something that they look at and go, oh God, I really just hate doing this, because that'll just bring your stress levels up as well. Posture is actually quite a marked one that I see. It's very, very common when your balance isn't so good to lean forward more. Now, this is done as I mean, we all do it. If you see somebody that walks onto what they think is going to be a slippery space, they lean forward and the arms come out to try and reduce your chances of falling. But leaning forward moves your central gravity forward and makes it more likely that you're going to go off balance. Falling forward feels safer than falling backwards, which is why we often tend to lean forward rather than leaning backwards. Rather than saying, well, just hold yourself upright, it can be difficult with a vestibular issue to know exactly where upright is. Hence the shoulders over hips, hips over ankles, and that will help you line up a lot better. And whilst you're standing and you've made a note of your shoulders are over your hips are over ankles, just become aware for a few moments of how is your weight distributed across your foot. Is your weight bearing on your heels and your toes, which means you're tipping forwards? Or is your weight on your heels and your toes are tipping up, which means you're tipping back? Just take a moment to bring your weight and shift your weight so your weight is equally across the whole of the foot. And that means you are more upright and you are more stable. Now, I've just been harping on ever such a lot about moving, but rest is really important as well. When your vestibular system isn't working so well, your brain is doing at least double the workload trying to keep up with your balance, and it's brought up to a more conscious level, which isn't its job to be dealing with balance, so it doesn't do it as well, and it does it a lot more slowly. You need to rest. You need to give your brain a chance to catch up rather than keep going and going and going and pushing and pushing and pushing, because the brain gets tired. When it gets tired, it starts to make mistakes. When it starts to make mistakes, it's then got more work to do, which is going to make it even harder and make it more tired, and it's all too much. Taking lots of little breaks and pacing yourself will make things much, much easier for your brain to deal with what it needs to deal with and to do it more efficiently, much less stressful, much more pleasant. But please be aware that pacing yourself is not the same as avoiding things. It's no good just saying, well, I'll just, rather than walking around a lot, I'll just sit because walking makes me feel a bit odd, so I'll just sit. We need to stimulate the balance. We need to do the things that don't feel that nice. We need to do them in a safe and controlled way, but we need to rest as well. So just pushing and pushing and pushing, you're not going to be doing yourself any favors. We get further faster with vestibular rehab when we do it gently with these breaks in the middle of the, as well as say, doing it little and often rather than going bullet a china shop in it. Mindfulness. I know there's some members on here that practice mindfulness, and you've had, I think it's Debbie that has talked to you about mindfulness and the benefits of these. It is a fantastic thing to be doing just as part of life. We're not built for the life that we've made ourselves to be constantly on the go and everything to be so fast and so continuous. The human brain and body is designed to have a bit of activity and a bit of a break and a bit of socialization, a bit of activity, a bit of a break. Mindfulness can really help just slow your brain down, just take a few moments out from what you're doing in the day. But it tones down the stress response in your brain. And the stress response causes feelings of imbalance. So it's, yeah, lots of boxes again with mindfulness. Mindfulness is whatever it is that your brain can just lose itself in, that it just enjoys, that it's not focused on anything else, it's just focused in on that one thing, and it can breathe. So it could be a particular hobby that you do. Some people like colouring, not so great if you've got a visual preference, but colouring, it can be reading, it can be listening to certain pieces of music. People often say that playing an instrument is very mindful. Football, whatever it is that you enjoy. And it can be trial and error to find what it is that your brain just loses itself in. There's lots of apps that you can look at that are free that can give things like guided meditations or audiobooks, sleep stories. There's lots of things out there. Trial and error to find the thing that works for you rather than the approach of, I tried mindfulness once and I couldn't make my brain go completely blank. It doesn't need to be like that. Simple breathing techniques are really, really effective. One I often suggest to people is what I term the longer out than in. Technically, it's called the 7-11, but I find that a little bit demanding. The idea of it is being that you breathe in long, soft, gentle breath in, but the out breath is much longer, much softer, much more gentle. You can do this in and out through your nose, so nobody can see that you're doing it. But the out breath is so gentle that if you put your hand underneath your nose, on the breath out, you can barely feel any air passing on your fingers right underneath your nose. It is that long and soft and gentle of a breath out. And that is very, very effective. CBT, counselling, NLP, clinical hypnotherapy, there's a whole variety of different psychological inputs that we can try. And again, it's finding the right one that works for you. CBT can be really, really effective. Often it's finding the right person for you. It's very, very common with balance issues to get what we call a hypervigilance of your symptoms, that feeling of imbalance. But feelings of imbalance don't just come from the vestibular system, as I've said before. It comes from stress levels, it comes from tiredness, it comes from flare up of any other health issues can make you feel off balance. Lots of different outside factors will cause feelings of imbalance that is perfectly normal and you will have had before, just before you haven't put any meaning to it because you think, oh, I'm full of cold and I feel woolly headed. It passes, you never think about it again. Once you've got a vestibular issue, it's very, very common to go, oh God, not only have I got a cold, my balance is worse, my balance is bad, what's happening with my balance? And the stress level hikes up. So the psychological aspects can be really, really helpful in just finding how to cope with those and to not let the hypervigilance start to trigger further feelings of imbalance. But say the right person with the right speciality, whether NLP works for you, whether it's CBT, it can be a bit of a case of trying a different person or a different type of approach to find what works for you, and that's perfectly okay to do so. Now, Cardiff University have developed a online game that can help with visually provocative imbalance. So those of you that have the dizziness when you're in supermarkets or walking the kids to school and you're walking past the railings, anything where it's a complex visual environment or visual movement that triggers imbalance, they've come up with this game to try and help retune that for you. And that's a free to access game. Hopefully that link will work and that will be passed on for you there. Now, support is such an important part of dealing with any kind of balance issue, any kind of chronic health issue. It's so important to communicate. Balance issues are really, really difficult for people to understand because you can't see it and it's so hard to describe a feeling. It's like, I mean, using the word I feel dizzy can mean completely different things to different people. In the same way that I can sit here and say, when I look out the window, the sky is blue. The blueness of the sky here may be entirely different to the blueness of the sky where you're living. But we mean the same thing, but it's completely different. So it can be very difficult. So trying to communicate as best as you can, being able to say to people that you don't feel able to go to a very busy pub but perhaps you can meet them in a very small, quiet cafe where you're able to sit with your back to the rest of the cafe, so you've got limited visual field, and that's more suitable for being able to socialize for you, maybe. Being able to say to your partner, you just need a few minutes just to let everything catch up and you'll be all right. Communication is key. People can't see what you're experiencing. It's difficult to understand without that input. You've got to do what's right for you. If you are not feeling able to go to the massive family wedding because you know it's too much and you're really not feeling very good with your balance at all as it is, being able to say, I would really love to, but I can't at this time. Hopefully, we'll meet up at another occasion, or finding other way round. I'm really looking forward to seeing the pictures, but I'm really sorry I can't be there this time. You've got to do what's right for you. Please don't be putting yourself in a position where you are feeling awful to make somebody else happy, because it just doesn't work and it just makes things far more difficult. Try and really positively engage with those around you. Try and positively engage with this support group. Kevin has done the most wonderful job in getting this all put together and putting together so much useful information for yourselves and to share with your partners, potentially people at work if that's felt to be suitable. That encouragement and that help and support that's there is just invaluable. So please do engage where you can. And know that there is hope in changing your balance, getting things better than they are, even though it can take a long time and a lot of hard work and a lot of navigating difficult environments with gaining the correct healthcare, with getting the right support, potentially with work, relationships, all these things. It does get better and things will get easier. There can just be a lot of hard work to get there, but we do get there. Steady Steps is a fantastic program. It's a free 24-week program aimed at people over 65, and it's aimed at people that have fallen or have fear of falling, or that are needing extra input to try and improve balance and stability. It's fabulous. And the work that I do, my aim is all working on your vestibular system and getting that as good as we can get it. When there's issues such as arthritis or back issues, unfortunately, I can't help with those things. Steady Steps can be really helpful in negotiating, moving effectively and safely. So I really do strongly recommend the Steady Steps program. Medications I mentioned a little bit earlier, things like prochlorperazine, Stemetil are vestibular suppressants. They have their place for short-term use and in the acute phase when all hell is breaking loose. Absolutely fantastic. As an ongoing treatment, they don't solve the problem, they dumb down the symptoms. To treat it, we need to stimulate the vestibular system. So if you're taking vestibular suppressants and also doing vestibular rehabilitation exercises, we're going to be limited as to how much progress we can make. That doesn't mean we can't make any, but it will have an impact on it. Medications prescribed for anything else, I'm not messing with. Do speak to your consultants, your GPs, if you feel there's any potential problems with the medications you're on, but please don't just randomly stop any medications prescribed for anything else if you're worried that it's adding into your dizziness. Pretty much every medication I've ever come across lists headaches and dizziness as potential side effects. So please don't make any sudden changes without appropriate input. Antidepressants, I know a lot of people get prescribed them quite early on by GPs with the you're feeling off balance because you're stressed, therefore take antidepressants. And the response to that is nearly always, I'm not depressed, I've got a vestibular issue, which, yes. But they do have their place. They're not suitable for everyone, and not everybody wants to go down that route, and that's absolutely fine. But antidepressants, when appropriate, can be really, really helpful. They can just help tone down that stress response enough to make it easier for us to work on the physical vestibular issue and get that more under control, get that feeling much, much better, and then hopefully able to potentially come off antidepressants for your brain to then be able to realize that actually the vestibular issue that was causing me a lot of stress isn't there anymore, so there's not so much I need to be stressed about. So they have their place, not suitable for everybody, but they can be really helpful. But do discuss it if you're needing to. And the balance belt. Now, this is a relatively new thing. It's not currently widely available, but there is availability of it. Now, this is a belt that you wear around your waist. It has vibrotactile sensors in the belt, and it detects how you're moving, and it vibrates to give your brain some guidance as to where your body is and how it's moving. Now, this is designed and can be suitable for people with bilateral vestibular failure. So when both vestibular systems have little function, it can be helpful. And it's, again, same with anything. Some people have done fantastically well with it and it's been the best thing ever. Some people, it's not helped quite so much. But if it's something that's suitable and you're up for giving it a go, it's worth giving it a try. But it's only suitable for some people. But worth speaking to the consultant about if you potentially fall into that category. And that's a very quick rundown of various bits that you can try yourself at home and what we do with vestibular rehab. And I shall let you have a mull over of all of that because I know that's quite a lot to just throw at you with that. But yeah, anything that's you've got any particular questions about, then please put them in the comments and we'll try and address those. I'll just come out the screen and I'll pass you back to Kevin.
Lovely. Thank you so much, Michaela. Things sound a lot simpler when you say them. But we know the subject is incredibly complex. But that was brilliant. Thanks very much. Just to remind everyone watching, a copy of Michaela's slides will be sent to you as a PDF file as well. So you'll have those. And any links that we're discussing that are in the chat, you get a copy of the chat text with web links again via email. So don't panic about taking anything. Just on balance belt, Michaela, before I forget, I did put it in the chat. We've worked with Erland at Balance Belt, and he's kindly donating one complete set with all the necessary support meetings free of charge. But it's only available to a member who is already on some form of PIP or benefits. But for those that could possibly afford it, because it's not cheap, last time I looked, I think it was around £4,000. I seem to recall, which is an awful lot of money. But there is a 10% discount being given to anyone who's a member of this group as well. As Michaela said, it's not for everyone at all, but it can make remarkable difference to some people, some conditions. So that, Michaela, do you know what list of conditions there are that normally the balance belt suits? I'm never quite sure what
Certainly
to say.
bilateral vestibular hyperfunction, or vestibular loss. Potentially some triple PD, I believe, but it's more aimed at the bilateral vestibular loss.
Okay, super. And of course, the people at balance belt are the first thing they do is check whether your condition qualifies for the belt. They're very, very nice people. So, Michaela, I'm going to let you sit back and rest for a minute and grab that cup of whatever. But but not for long. Don't go. It's question and answers. I would guess in about 5 to 10 minutes that we're gonna come to you. So now we are going to hear from one of your fellow members. I want to call him Mr. Watson, but he'd rather be known as Phil. So Phil, if you can unmute, please, so we'll be able to hear you. Um, this cropped up when Phil contacted me and mentioned that it's often overlooked, but citizens' advice can be a great place to go to get help for various aspects in our lives. That this, until you get a balance condition, you may not need any help with anything. Then suddenly, you really do need help with certain areas. So, Phil, if I may, I'm going to pass over to you. If you just introduce yourself and tell us a little bit more about citizens' advice, please.
Right, right. Can you hear me now? All right.
Yeah, yeah,
Yeah.
that's good.
You said you wanted to know a little bit about my condition. Well, I'll make that very, very brief. I was a very keen sportsman, did a lot of cycling. I noticed in some of the chat there are cyclists, which is good to see. But 8 or 9 years ago, I saw Professor Ray, and he diagnosed vestibulopathy. Soon after that, I lost the balance, the ability to ride, so I had to give up my bike. But I did get hold of a trike. Again, somebody mentioned that, which has been brilliant. If anybody likes getting outdoors, then something like a trike is a brilliant idea. But I suffer from all the usual things that people here have talked about, the triple PD and the blurred vision but primarily exhaustion. It seems to be my big thing. Anyway, so I do whatever I can to keep myself fit. So I exercise as much as I can, little bits here and there. Um, but I also like to keep my brain engaged. So I'm involved with 4 charities, one of which actually is in one I helped set up in Bangladesh. So I visit that periodically, hopefully later this year. Um, but the other one is Citizens Advice, which I work with once a week for a full day. Um, Now, citizens advice, it's a lot of people don't seem to know very much about it, but it's a huge organization. There are over 320 offices around the UK with several outposts. Um, Unfortunately, many have lost their funding either because of charity or because councils have stopped supporting them. So there are far fewer than there used to be. But nevertheless, they do provide free advice for a wide range of people in all sorts of things like there's benefits, employment issues, money and debt, energy, and so on and so forth. So it operates in various different ways. I work at the one in Loughborough, where there are 6 paid staff, but over 40 volunteers like myself who have a bit of training and then advise people. So some of the things that we do, for example, that might be relevant to people listening here is a lot of form filling. Now, if any of you have to go online to fill forms in, you'll know that it can be an absolute nightmare. PIP forms, for example, there are 40 odd pages to be completed. So one of the things we do is we do enable people to come into the office if they can and help with filling in forms like PIP forms, like Blue Badge, like disabled passes for buses and trains, universal credit, if anybody's on universal credit. There are things like work capability assessments, and we can help with putting those things together. Now, the help can take various forms. One is face-to-face, which is what I do most of the time. A lot of volunteers do it by phone, and a lot of good advice is given by phone. We can send emails, but the other one, of course, is the website. And on the website, there's a program called AdvisorNet, And AdvisorNet is a huge resource covering all the issues I've mentioned and many, many more. And you can navigate, it's very easy to navigate your way through to the kinds of issues you particularly need help with. So AdvisorNet is a really valuable, it's the one that we use in our face-to-face, except the advisors get a little bit of extra help in making the right recommendations. So what I would say is that Citizens Advice is as I say, a free service. You can't do better than that. And you never know, there might be something in there that might, if you're having in particular problems, that might be of help. That's enough.
Very good. That's lovely, Phil. Thank you very, very, very much. And I think, as Phil said, it's often overlooked that those resources are there free of charge to us. And form filling is a nightmare. We were recently doing power of attorney forms, and oh my goodness. And the trouble with all these forms, as Phil will know with the work he does, you get one thing wrong, and you can have wasted a month or whatever it takes for someone to spot the error on the form. So very good. Thanks ever so much for that, Phil. Just before we go to the Q&A, oh, it's just two people to let in. Before we go to the Q&A, I just want to mention something that's a bit strange for the group. We're not normally very political, but one of our members, Steve Watkins, he had a meeting with an MP several months ago, who then started something called an early day motion, which was to state that we needed better access to treatment. Wouldn't it be nice if all of the balance departments knew there were such things as our support group and other groups that would help people? And one other thing we've been really advocating for is centres of excellence, where you can get all the right resources to treat people with balance disorders, but in a few strategically placed centres around the country, because it's simply not working, spreading too few resources everywhere. It's just not working. Such as Professor Ray is also a champion of that. Update on that, and I'll just share this. It just shows sometimes good things can happen. Hopefully you'll be able to see a photo up here. That happens to be the Shadow Undersecretary to the Department of Health, Conservative MP for where I live. It just happened to be walking by my house a week ago, so I collared him. And we've now got a meeting in a month's time to discuss how best to proceed to get the Department of Health to start taking this seriously. I will be sending out via email another appeal for everyone to please contact your local MP. And we even give you a template of how to do that via email. Further to that, some members have already responded that there's been a couple of great responses where MPs have submitted the questions. But there's been one or two, I have to say, who it looks to me with how they reply that they might not be even reading your email or seeing that you've asked them to submit a question. My response there is go back again to them and say, I'm sorry, I don't think you read my first email. Can you please submit those questions? Because the last time I looked, the MPs were there for us, not for themselves. So if at all possible, please support us doing this. But as I say, we normally don't get involved with politics, and to be honest, we're looking to make this a cross-party thing. And I've just put in the chat a link where you can monitor if your MP does actually submit the questions they've said they're going to. Which that link was supplied by one of our members. Thank you. So enough of politics, because this is normally more about just us as individuals. And I say Michaela's presentation was great. It touched on so many points. There is so much we can do to help ourselves. It will never replace getting expert treatment, which is so important to get that correct diagnosis. Um, but as Michaela said, one of the big things here, and you're all practicing it today, is to share, talk, learn. It's don't shy away from these things and get the more you know, the more you can deal with what your issue is. And the more you share with others, especially fellow members, the more you'll learn what works for them. And one of my little hobby horses, it's probably one of the best things I think we brought to the group. It's called Member to Member Network. Over 150 people, members now belong to it. You just opt in, you supply your email address, where's the nearest town or city to where you live, and that list is shared with everyone else who's opted in, and you will make some brilliant new friends, people who get you, people who know what you're going through. And especially when you find someone who's in exactly the same life cycle as you, life stage, with a similar condition, you'll be amazed at what you have in common and how much you can help each other. So I think someone's not muted. I heard a voice. So if everyone can just check you're muted. Other than Claire, I'm going to ask you,
It's
please.
four. Oh, I tell you, I tell you numbers.
Oh,
It's
I'm
four.
I'm going to have to look for some culprit who's making a noise. Claire, if I can bring you in, and Michaela, I'm going to bring you in as well. And Claire, if you could start off with just a couple of questions from the chat, and then we'll go to the main list. So it's just the first couple from the chat, if you've got those.
No, because I've done it the other way around. I've got the one
Oh,
pre-ones
no,
ready.
fine, do it the other way around. Do that. No, apologies. That's me being disruptive as usual. You
Sorry. First
start
come,
with
first
the
served.
list.
They were
Yeah,
submitted already.
lovely.
Okay.
Thank you. Yeah, I'll leave you to it. Over to you both. Thanks.
So the first few are from a lady called Angela. I presume it's the same Angela. Question 1. What's the difference between a vestibular audiologist and a neurophysiotherapist, and which is more effective to help with triple PD?
So, as an audiologist, our background is training in audiology, so hearing aids, the ear, neurophysiologist, physiotherapy background that specializes in neurology. For me, I think the importance is seeing somebody that their special interest is in balance and vestibular issues, whether they're a vestibular audiologist, whether they're a vestibular physiotherapist, whether it's neurophysiotherapist. As long as their interest is in vestibular and balance, you're going to hopefully do okay. When it's a more generalized approach, it can be a bit more hit and miss. But it also depends on the conditions that you're experiencing. So I might be someone for their balance, but suggest they see somebody also for general physiotherapy because some of the balance problems are coming from their back, for example. So it depends on what you need, depends on who's going to be the most suitable one for you.
Next part of the question, how can she find a good vestibular rehab clinician, either NHS or private, who has experience of people with dizziness?
So here is a fantastic place to start. You've got lots of members here that have got lots of experience of trying different people in different places, and there may be someone local to you that somebody's able to recommend to you from here.
She lives in the Suffolk area. Is anybody else on here that got that information?
Yeah, it's not an area I'm familiar with as to who's around there, unfortunately, so not anyone I can point you towards. But if you're having to look via Dr. Google, then look specifically for a specialist interest in inner ear balance.
Thank you. And the last bit, can vestibular rehabilitation be done effectively remotely?
Yes.
Agreed.
Except for Epley manoeuvres, that's going to be a little more challenging doing it online. But yeah, any kind of vestibular physiotherapy besides particularly for BPPV, yeah, online's not a problem at all.
Next question from Ian. He's suffering with variable triple PD. better weeks and worse weeks. He understands that with VOR and vestibular exercises with triple PD, the VOR exercises act to reduce the symptoms, but when things are better, should they be continued as preventative, or are they not useful when the triple PD is not so bad?
Now, it depends on what version of better we're talking about. Whether it's better, full stop, no symptoms for quite a period of time, everything is fine. You don't need to carry on with exercises to maintain things. Just keep as active and as mobile as you can. The worst thing you to do is become immobile and inactive. If we're talking about the version of better, as in things are better than they were, but there's still issues, carry on with the exercises. We want to keep going until things are as good as we can get them. So yeah, it depends on your version of better.
Question from Neil. I think you did touch on this in your talk. He's seen it said that when it comes to Meniere's, that vestibular therapy is only really useful in the end stages when the attacks of vertigo have reduced or stopped and the overall damage is done. But before that, the attacks can undermine the therapy. What's your view on this? And is there any good clinical evidence for benefit from earlier intervention?
So certainly there is benefit from what's termed as prehabilitation. So if you're going in for an operation or something like that, then prehabilitation can be really helpful and get you kind of into the habit with the exercise, get you confident in what you're doing, and that can make things a lot easier and retuning after. With Meniere's, it depends on the duration of kind of gaps between the attacks. If you're getting a lot of very close together attacks, there isn't time for the vestibular rehab to start changing things with the balance and things to start compensating effectively. However, if you're getting decent sized gaps, and that time frame can be quite variable, there's not a nice hard and fast answer to it. But if you're getting decent sized gaps in between, rehab can be really, really helpful in making things much easier in between these exercises. So please don't kind of go through the Meniere's journey and wait until right at the very end to then start rehab, because you'll have missed out of lots of improvement that could be made in between. But the vestibular rehab isn't going to prevent a Meniere's attack. It's not going to cause a Meniere's attack. It's not going to help during a Meniere's attack. It's for the in-betweens.
Michaela, can I comment
Please,
as a Meniere's sufferer? It really is trial and error. And when it's the wrong time is when it, as Michaela said, too close to those awful, dreadful vertigo attacks, which, just for those not familiar with Meniere's, it's a bit like the sensation I can imagine a hand grenade going off in my brain, and everything is so damaged and fragmented for many hours after the attack that you forget any form of vestibular therapy. For me, interestingly enough, it was at least 2 to 3 days after an attack. And the only way I can describe, looking back, trying to remember this, because this is some years ago when I was going through that awful, awful time, you just got to know when you were completely wasting your time and making yourself just feel sick and lousy. And then you could compare that to other times when you tried and you were thinking, actually, something you said, Michaela, that I'm not liking it, but I can tolerate it, was the feeling. And that's when it started to do good. And those simple exercises Michaela was going through, that's all really I was ever doing, but they worked wonders. And they restored a much better balance functionality until the next attack. But it was well worth doing between the attacks to get there. And it's something quite interesting. This is 20 years ago, the very first attack. I still, because one side was quite damaged, I still get the odd half a day when you go, do you know what, that balance is just not right. And a few minutes doing those very simple exercises kind of just very quickly resets. So it's something I've sort of taken along with me now that really still works. So I hope that helps people out there. I would say just never do it where it's just making you feel dreadful. Your body's saying this is not the right time to do it. But and just on a funny side, I ended up doing my best rehabilitation was done trying to run on a treadmill watching a TV. But I did have arm rails. But I found it was tremendous at speeding up. That was some years into it, so I'm not recommending that to anyone and everyone. But it's amazing what you'll find. One last thing, and I'll shut up. The mention of cycling. I now go out 3 times a week. Absolutely love it. It's great for the mind, great for the body, and persevere. Because I assure you, I spent many years thinking I'd never ride a bike again. Things do get better, and there are now these wonderful trikes, the 3-wheelers. So do as much cycling and as exercise as you can. Right, I'm off. I'm shutting up. Back to you.
The thing I'll just make a mention about with trikes is that if you're used to riding a 2-wheel bike, you lean in a certain direction when you're turning. On a trike, you have to lean the opposite direction. If you lean the same way that you would do on a normal bike, you go wandering off quite a lot wider than you expected. Not great on a road.
Wow.
But yeah, with the rehab, we're always looking for manageably unpleasant. We're not looking to push it to the point where you feel horrible. We want manageably unpleasant.
Next question, new condition. This is Lenny on behalf of her husband, who's recently been diagnosed with normal pressure hydrocephalus. Can any physio exercises help while he waits for surgery?
That one I would have to say is outside of my expertise to be able to advise on.
And presumably any exercise is good exercise, but not being specific.
Potentially it's the normal pressure hydrocephalus, that's not a vestibular condition.
Right.
So that's one that you'd potentially be needing to speak to neurophysiotherapist about.
Next question from Rhiannon. Are there any specific exercises that can help desensitize the brain for increasing digital use whilst managing triple PD? Or to what extent is it more to do with changing the mindset and managing anxiety when digital systems cause a detrimental effect?
Okay, so digital systems, so any kind of screen work is a visually provocative situation. And if your vestibular system isn't working quite so well and your brain has decided to go for that visual preference, that over-reliance on visual information, movement on screen can cause a lot of visual trickery as to what's moving and what's not. There are lots of exercises to build up towards use of screens, and the Balance Land online game can be helpful with that as well. So there's not one specific exercise that's going to fully encompass that. That's something to work on with an appropriate vestibular therapist. Certainly the mindset can add into it as well if you're finding it stressful. If you, for example, your workload is a lot of spreadsheets and you've got a big deadline coming up, the stress is going to add in some feelings of imbalance. But the other thing to also consider with it is that when we're dealing with stuff on screen, we get fully lost in it and we can think we've been on it for half an hour and we've actually been on it for 5 hours. Taking lots of breaks will make a big difference. So rather than sitting and just keep going and going and going, whether it's set a timer or you look at just a little bit online for a short time, come away from the screen, let your brain catch up before coming back to the screen. You'll actually get more done because you'll be more efficient if you take lots of little breaks rather than just go in at it and be there for hours.
Thank you. Next quick one from Angela. Is hypnotherapy a useful tool for triple PD? Could you tell us a bit about it and what's the best way to access it?
So yes, hypnotherapy can be helpful with triple PD. Hypnotherapy doesn't tackle the vestibular issues. So it's not a just get hypnotized and it'll all be made to just disappear for you. That's not how it works. But the hypnotherapy can help reduce kind of the brain's emotional response to feelings of imbalance and thereby the stress response not creating further feelings of imbalance, which is a big part of triple PD, that your brain's picking up feelings of movement that it's then interpreting as a stressful, threatening thing, and it causes further feelings of imbalance. So it does have its place, but you've got to have the actual vestibular issue effectively tackled. So it's not a kind of an initial go-to, but it can be appropriate in some circumstances. With regards to finding suitable ones, it's going to be trial and error to find what's available to you locally. Hypnotherapy, I find a lot more challenging online. It's difficult to pick up on a lot of the physical cues from people. We miss a lot of body language. Can't pick up things like breathing pattern, which can give a lot of indication as to kind of what's going on in people's brains stress wise. So yeah, it's having a look around, see what's available, any recommendations that people have, and finding the person that suits you. You might try someone that's been highly recommended, but you go in and you go, yeah, this is not for me. Trying somebody different.
Okay. Next one is from Mandy. Let me just read this in my head first. My question is, how to bespoke the exercises to the person? How can the physio know, or is it better to see an audiologist who can hone the exercises? What do I need to be aware of? The episodes can come on when I'm sitting doing nothing, just looking out of a window.
So what I'm looking for when I'm talking to people to work out what exercises to give them is, and everybody that sees me knows pretty much one of the first questions I'll ask is, what kind of movements, places, situations make you feel bad, that you struggle with, or that you find challenging? So movement, places, situations. I can see patterns in things that you as a sufferer won't see. So I can see that feeling off balance when you're just sitting looking out the window when it's raining, or when you're walking your kids to school, or when you're doing a quick run round Tesco. All of those very, very different situations. But from my perspective, they're all visually complex. It's the visual information that's causing difficulty there. And that means I will then tailor my exercises more to a visually provocative exercise. So don't worry about you looking for and giving us the pattern. Tell us the circumstances or what you were doing at the time when you had that feeling of imbalance, and we'll be able to work it out from there. And that's how we tailor the exercises.
Okay, Claire, I've just got to take over reading the questions for a minute so Claire can have a rest. As usual, Michaela, I've just got to do something else very quickly because we were talking about bikes and trikes. Hopefully you can all see that. I don't think Steve, that's Steve Watkins, who's also trying to do some PR for the group as well. And that's his trike. And he's had lots and lots of great fun with that. That was for members who've been with us for quite a while. They'll know the Daily Mail did an article on Steve and his trike several months ago. So, and don't tell anyone, but we're trying to see if we could get any discount from that brand if they would sell trikes to the members. So we're actively working on that to see if we can get things cheaper. So sorry about that interruption. Back to the questions. Mandy again, who says also, my brain sometimes doesn't seem to function as well with everyday tasks. I feel like I have early onset dementia. Is this typical?
Yes. The very short answer to that, that's absolutely typical. Balance, as I mentioned before, is a subconscious brain response. We've learned it from when we were tiny up until today. It's a subconscious process. The subconscious part of the brain deals with huge amounts of information super efficiently. It's balance is its job and it does it fabulously. When balance isn't working quite as well, it gets brought up to a more conscious level. Now, the conscious part of the brain, being very polite as I can about this, it has a very limited capacity. It can only deal with so much, and it doesn't deal with things quickly. Balance is a fast process. So the fact that it's brought up to a conscious level, one thing, it's not its job. The conscious part of the brain, it's not its job to be dealing with balance. It doesn't do it really fast enough, and it takes up a huge amount of its capacity, which means there's far less for your conscious part of the brain to be able to deal with your normal daily activity, your normal daily tasks, the things that you think about and have to remember. It's a much, much reduced capacity to be able to do that. Concentration is on the balance. Concentration is not so good, so things then don't go into the memory banks because the attention wasn't there in the first place for it, so the memory seems worse. That's all a very, very normal part of the process, unfortunately. It does get better as the balance starts to improve and confidence starts to improve. The balance will improve as well. And I've forgotten the first part of the question to that, sorry. Got carried away
No, that
with
was it. Was it dementia? And if I just add to it, Michaela, as well, because it comes up an awful lot with conversation I have with members. This brain fog, the dementia, the difficulty, it again, because you've not broke your leg and you haven't got your leg in plaster, you can often yourself forget this is not you on a good day or with perfect health. So you've got to be kind to yourself and appreciate you cannot do what you were doing prior to these problems, episodes, conditions. I was my own worst enemy and early days, and I thought I could just carry on as normal. And I got really angry and frustrated with myself that some days I couldn't do one email without having to stop and rest. It's just realised you're not well. If you'd broke that leg, you wouldn't be going for a walk and you certainly wouldn't be running. So it's just with the mind, just sort of be gentle to yourself, number one, because things will get better. Next question for you, Michaela.
just jumping because I remember the other part of it. You will get good days and bad days, or some spells that are better than others, and that's because of the amount of outside factors that influence how you're feeling generally with your balance, your stress levels, your tiredness, your general health, your activities that you've been doing prior to that day, things that you're planning on doing. So there's a lot of outside factors that are completely unconnected to your vestibular system that will influence how you're feeling with balance as a whole. So that's perfectly normal to have the ups and downs with it.
Yeah, super. One thing you can be sure of, if you exhaust yourself, if you push yourself too hard, you're going to have a rotten time. Yeah, the symptoms will just seem 10 times worse. So don't do
Pace
it.
yourself because overstimulating and overwhelming the system's just going to make things an awful lot harder than it needs to be. Pace yourself.
Next question from Jane. Can you ask Michaela if she knows of a hypnotherapist in the Northwest who can help with disequilibrium whilst walking and other vestibular problems? Hypnotherapist.
Yeah, there's not anyone that I can particularly signpost you to. It's not one. Not
I'm Northwest based, and if Jane emails into Kevin afterwards,
We've got someone. Oh, is that Claire? You're not muted,
Yeah.
Claire.
I only became aware of him the other day, so I want to find out a little bit more. I did Google him before this when I saw it on the questions session, but
Yeah.
I'll email that information over after. I don't know how you would get in touch, but I think I know there is someone.
Brilliant.
Thank you.
Lovely. Super duper. And then on hypnotherapy again, Jane again, I'm also interested in self-hypnosis. Would Michaela recommend learning how to do this, and how would I find out about this?
So there's kind of quite a crossover with self-hypnosis and kind of mindfulness and guided meditation, guided visualization, and it's finding the one that works for you. So as I say, there's various apps. I'm just trying to think now of there was a very good one. It's a blue book. I think it's Mark Watson. it'll come to me later. I'll need to dig the book out and send it to you, Kevin.
Send me the link and I'll put it in the email to the
Yeah,
members.
I'll have to hunt that out. But yeah, there's a good one that gives kind of quite a lot of guidance as to that side of things.
May I put a supplementary question? And how important or relevant is hypnosis to generally treating, what you do? Does it help certain people, everyone? What's your opinion on hypnosis?
So hypnotherapy, it can be really, really helpful. A lot of the techniques in hypnotherapy can be used without the kind of hypnosis element. The hypnosis kind of helps bring your brain's attention from outside to just losing itself kind of internally, if you like, into kind of that it's guided visualization, essentially, kind of using your imagination, that daydreaming part of the brain, and being able to guide it can be really, really helpful. Can be really good for relaxation. Sometimes it can be very helpful with your brain having the chance to kind of highlight something that it's been finding very stressful that it's not been able to convey. The subconscious part of your brain doesn't have language. It can't just say to you, I'm upset about the shadow in the bushes over there that I'm walking towards, or that somebody said something to me a while ago that they're still, that kind of what they said is still bugging me, and I'm upset by that. It can't just say it. The way your subconscious part of the brain communicates is by sending out feelings. So it changes your heart rate, it can change your breathing patterns, it can cause changes to digestion, gives you the jelly legs, and it's just your brain's way of trying to say, I'm picking up something I deem potentially threatening that I wish to bring to your attention. But the conscious part of the brain has language. It doesn't speak in feelings, it speaks in language. So it then has to interpret what's being said. So if it's interpreting the wrong thing and deals with the wrong thing, the subconscious part of the brain just kind of keeps shouting. So hypnotherapy can just help kind of tune out conscious part of the brain getting too involved and trying to analyze so much, to give that subconscious part of the brain more of an opportunity to kind of bring forward what it's trying to communicate. Yeah, it's lots that we can do, but it's not necessarily the kind of the magic wand easy answer that people are sometimes hoping it might be.
Yeah, we
Although it
all
can be.
want easy answers.
Oh, absolutely.
Next question is from Laura. Hello. Please can you suggest ways for coping with milder embarkment after long car travel journeys? Thank you for Laura. I also suffer from BPPV. So that's an interesting one of car travel.
So car travel, the travel sickness is a very difficult one because there's not a nice, simple solution to that. It's very, very common in migraine sufferers. And if you're a migraine sufferer and you're traveling, vestibular suppressants, just anti-nausea, vestibular suppressant to make things easier. And then you're not going to feel as bad after the journey. But again, this is going to come into the pacing yourself thing, rather than go for that really long car journey and try and just get it over and done with and then feel awful afterwards. Try and break the journey up, try and make lots of stops. Sitting in the front passenger seat is going to be way better than sitting in the rear passenger seat. Looking forward and kind of pretending you're the driver and anticipating what's coming as if you were driving helps your brain process that motion and what it's experiencing, as opposed to when you're sitting in a passenger seat looking out the window and everything's moving, then looking out the window but not really paying attention, talking to the person next to you. Keep looking ahead, keep anticipating what's coming, but lots and lots of little breaks. Just pace yourself as best as you can.
You. Jackie, interesting one here. Jackie had dizziness, nausea, fainting spells on and off for many years. Nothing was found to be physically wrong by the doctor, who put it down to anxiety. She had increasing doses of anti-anxiety medicine. She changed house or moved house and changed GP. After going to A&E twice with a suspected stroke, she was very lucky to be referred to a centre where she received help from a team of professionals, including specialist physio, psychology, and occupational therapist. She's learnt so much from them, and her life is beginning to open up, which is brilliant. And she feels so much better. A question is, and this I think faces all of us at some time, what are the chances her conditions may come back in the future? Or has she beaten it? Or is this just a period of remission? Answer that one.
That's a difficult one because I don't know what condition she's been diagnosed with.
Yeah.
I would just like to point out that fainting, if you are losing consciousness, that is not a vestibular symptom. There's something else going on there. You need to speak to a relevant medic, but fainting is not vestibular. So, as I say, I can't comment too much because I don't know what condition she's been diagnosed with, and what's specifically been going on there. With regards to generalized vestibular issues, whether they can recur, having had a vestibular issue and it being resolved doesn't necessarily mean you're more likely to have another one again. Doesn't rule you out either. But if you do have a further issue with vestibular system, you pick up a viral thing or whatever. Firstly, hopefully you've got an idea of what's happening, which makes it less frightening, doesn't make it any less frustrating, but hopefully it's less stressful, less frightening. Secondly, you'll have a good idea, hopefully, of things that you can do to help yourself with the exercises that you've done before. You can bring those in nice and early. And thirdly, hopefully, you'll have a very good idea of who it is that has helped you previously and that can help you again. And you can hopefully access them a lot sooner than when you're trying to desperately hunt for somebody that can help you when nobody's kind of necessarily knowing what's going on. So yeah, depending on the condition, depends on the likelihood of recurrence. Things like migraine, unfortunately, that's a neurological condition, and yeah, you can go for quite periods of time and have a further migraine. It's not going to kind of get ruled out from that. Meniere's at some point burns itself out. How long that takes to get to that point, couldn't tell you, but at some point, Meniere's does burn out. But yeah, for a more generalized vestibular weakness, doesn't mean you will have it again, but it doesn't rule you out from it. But you're in a better position if you do.
Yeah. No, good. Very, very good answer. And the only thing I would add, and this is so normal, so anyone and everyone who has this, I think this is just being human. During my active years of Meniere's, it didn't matter what the new symptom was. My brain went, oh my goodness, it's Meniere's. So get a cold, it's Meniere's. Stub my toe, it's Meniere's. It's just normal that we're looking for these things. And still to this day, I flew recently, had something I'd never heard before, barotrauma, where the eustachian tube was a little bit damaged for a few days. That's my good ear. And that started not working properly. And it was like, oh no, it can't be Meniere's, can it? So you're never free of it, but you just learn to control it.
And the thing is, you will have experienced feelings of dizziness, imbalance prior to any vestibular issue. Stress, tiredness, feeling unwell in any other way causes feeling imbalance and dizziness. And that's a normal bodily response, and you will experience them again. It's being able to pin the tail on the right donkey as to what's going on. And yeah, but a vestibular function issue doesn't necessarily happen again.
And that, what I just mentioned with you as well, it always tips me into that subject of hypervigilance, where I went through it from the second I gained consciousness in the morning. I was analysing, can I move, can I balance, what happens when I get out of bed? is so tiring. And in some conditions, like I think Meniere's, complete waste of time because it makes no difference. I get it with vestibular migraine where monitoring diet and other things that you can begin to see patterns possibly. But hypervigilance for me was nothing but years of wasted mental capacity that I didn't have anyway, and had foggy brain and all the rest of it. So
And hypervigilance in itself can cause feelings of imbalance because it brings your stress levels up, which then can trigger a feeling of imbalance. And that
yeah,
basically causes confirmation bias because you look for it hard enough, eventually you'll find it.
super. Next question, Rachel. I've had triple PD for 3.5. Yeah, Rachel, sorry for Michaela. I've had triple PD for 3.5 years, struggling with general fitness. Gained a little bit of weight. I do 15 minutes of Pilates every day when the dizziness allows. I've got an exercise bike. I'm gradually building up the number of minutes on it. I go for short walks, eat an healthy diet. Are there any more tips you can give me to reduce or reverse weight gain and improve my general fitness despite this infernal condition? Appreciate any tips you can give me.
So generally to that is keep trying to very gradually increase your activity levels, really gently, but really, really consistently. This isn't a case of I'm having a good day, so I'll do loads today and then have a bad week and not do anything for a week. Even if you're feeling a bit off balance and you're not really keen on the idea, try and still do something anyway, even if it's just a little bit, but really, really consistent repetition and gradually build on it and doing the things that you enjoy doing. So yeah, if the bike is what you enjoy doing and keep going on that exercise bike, Pilates, fantastic. There may be some movements that you can't do at the moment, but there's going to be others that you can. Do what you can and just keep nudging at where things are feeling a bit unpleasant. Manageably unpleasant is a good thing. Keep prodding at it.
Yeah, super. Really good advice there. And again, can't help but mention I discovered Pilates only a year ago. Best thing I've ever done. I've got one of the world's most inflexible bodies, um, and it's been great. It can be so gentle, but you can build up to what you were saying about better posture. Oh, it's tremendous. So recommendation, if you've not tried it, have a go at Pilates for basic beginners. Lots of YouTube videos. Really good, really good. Next question, Simon. Um, it's going to anything we can do when we feel or experience the onset of Meniere's or vestibular migraine attack that can ease or lessen or help with some of the symptoms we go through in that moment. I usually curl up into a ball and swear, sweat and sweat, but try and recite a mantra in my head, say, this is temporary, this will pass, over and over again, to try and accept the moment and not get overwhelmed and overstressed.
Yes.
So anything you can add to that, Michaela, anything that will help?
It is a tricky one because there's not any balance exercise or anything like that's going to prevent an attack of either Meniere's or migraine. Now, migraine people will talk about the things like lifestyle modification to try and reduce triggers, but that's a whole talk separately in itself anyway. Exercise routine, migraine brains like routine, and consistency. For many years, the advice often is trying to follow a low salt, low sodium diet, no caffeine. But these may be helpful for some and not so much for others. There's not anything necessarily as such that you can do to prevent an attack when it's kicking in, other than sweat and swear, which is absolutely understandable. But it will pass. It will always pass. And for those, certainly for those two conditions, speaking to your consultant to try and find the most effective control of those as you can. That
Yeah.
it tends to go into a more medical approach than needed than kind of a rehab and therapies type.
Yeah.
But,
No,
but you're probably better to answer that one, Kevin.
well, my own experience, there was nothing at all that ever helped other than many, and this one of the reasons starting sport groups, so people didn't have to go what I went. I went through 7 or 8 years of torture and really not understanding what I was doing because I was denying I was ill and hiding it and all sorts of nonsense, and then living with all that stress and anxiety. Um, the bit that changed for me is I finally reached a stage of I don't know what you call it, awareness, where myself worrying myself to death was not helping me. I'd been through so many attacks that even I understood I was not going to die and it wasn't going to get any worse. It was just what it was. In my case, 2 to 3 hours of the most wasted time and wanting to just pass out. But what made the difference was get to this stage of going, right, I know what it is. I know what's going to happen for the next 2 or 3 hours. There'll be no surprises. It's just horrible. Um, so the least I can do is not panic anymore or not get angry or upset but just go, oh, get on with it physically and live through it. And amazingly, with that change of mind, I never had such a severe attack ever again. And I don't believe it changed physically, it just changed how my mind perceived it. Because in other words, I wasn't sitting there smiling, I was doubled over a toilet. Um, but mentally, that illness, that condition lost its grip on me. I was free. Um, and that definitely it helped me so much to get not just the attacks but everything else. But and the difficulty, if I could bottle it up, I would do it, and I wouldn't sell it. I'd give it away for free. But if you can all reach that stage where you go, I know what this is. I don't like it, but it's not going to kill me, and it's going to be over soon. You, you're just free. Your life is so much better.
I think possibly putting plans into place as to how you can help yourself through those attacks could be helpful so if you know that kind of having access to a darkened place is helpful, knowing where those spaces are in at work situation or at home. I have migraine. I get very severe migraines that can make me completely non-functional for days. I've got my migraine medication stashed several places at work, in my car, in my handbag, in my bathroom, and by my bed. So I know that if at any point in any of those situations my migraine is kicking in, I know I've got access to that medication quickly and easily, and I can take control. I know that certain things, such as a very soft blanket, can be really comforting whilst I'm going through the worst of it. So I have those in the appropriate places. Having a plan as to how you can make things as easy as you can for yourself can just make things that little bit easier through what's a very unpleasant experience.
Yeah.
But it always
I
passes.
never went anywhere without 2 carry bags and a kitchen roll. But it gets better, folks. Honestly, I've had an amazing life since all of that rubbish. Next question. Sandy has triple BD. When using a balance mat, how often should I stand on it each day? For how long? And I'm assuming it's telling my brain to reconfigure itself. I'm not quite sure what a balance mat is, Michaela, so I hope you know.
So you can get balance mats, you can get balance boards that are unstable. So it's a kind of
Ah,
the
yes, yeah.
balance, certainly the balance boards are a kind of a firm surface, but on an uneven underneath. So you can stand on it and you've got to kind of hold your balance on it. So it's balance training, but it's more sort of full body balance training, kind of in the same sort of way as when people say when you're brushing your teeth, stand on one leg in the morning and then stand on the other leg in the evening, to just tune the balance, kind of full body as best as you can. It can be really helpful. But again, it's in this range of, it depends on what is suitable for you, whether it's manageably unpleasant or whether it's too much too soon. But if you're doing that, how long you can do it for is going to vary. So if you can only hold it for a couple of seconds, that's fine. Keep practicing it for a couple of seconds until you can increase it up to 4 seconds, and then carry on until you can increase it up to 6 seconds, and so on. But little and often is the key. And it depends on how practical it is to do during your day, but I generally say try and practice things at least 3-4 times a day. I generally don't advise more than 4 times a day, because then we potentially start pushing the brain into being overstimulated and overwhelmed, which can make things more challenging. So if you're looking at trying to do things more than 4 times a day, actually bring in regular mindfulness practice, and that would be a much better mix for you.
Yeah. Another favourite saying we've used for years in this group: balanced conditions and ourselves, we are in a marathon, not a sprint. And it applies to so many aspects of our care. Marathon, not a sprint. So pace yourself. Here we go. Sort of talking of which, Julia asks, if we are having a really bad day, a bad spell, should we push on with exercises, or do the simplest ones, or just take a break?
That's going to be dependent on what's driving the feeling so much worse. So if you're feeling so much worse because you've got a migraine, don't push it. That's just cruel. You need to take a little bit of a break, listen to your body and let it have that rest. If it's that you're having a bad day, that your balance is just feeling a little bit more off, try and carry on regardless with your exercises as best as you can. But if you're really struggling, tone it down to something a little bit easier, but still really consistent.
Super, thanks. Rachel asks, she said suffers badly with anxiety. She's had brilliant clinical psychologist last year, but the sessions have now finished. She's struggling to find anyone who can offer anxiety counselling. She's asked her GP, but most of any available free sessions are only for some 6 weeks. I'm looking for something longer. Can you recommend anywhere I can try, please?
It is a difficult one to access. Mental health services are so understaffed, under-resourced, and have such a big kind of need for their services. It's difficult. I was having a little look earlier. There's certainly in Leicestershire, this might be more widely available, but talking therapies, if you have a look for talking therapies, there's a lot of ones that you can self-refer to, and they'll provide what they can. Beyond that, potentially you're going to be looking to kind of more private provision, and finding the
I will have. I know we had Pippa on recently talking. I think there was some new online video-based courses that were free of charge, that may help. What we'll do for everyone, we'll put a list of useful websites on the email after this meeting anyway. And any Michaela, if you can let me know, and I'll pass those on. It is really difficult because we all see the headlines about mental health featuring so often in those awful tragedies and crimes in the country. So we know even those awful things are not being treated. You can see why it's so difficult to get resources for anxiety. But I show the one thing with anxiety and BANS conditions, you're not alone. It is so common. After that initial hit of the physical symptoms, the anxieties and the fears just start creeping in. And the answer is no, you won't be like that forever. So you heard that from me. That's definitive. Last question on the pre-submitted questions, then we'll move to the chat ones. And it's quite it's quite useful. It's quite vague. I have no diagnosis at the moment. I'm waiting for a first appointment with a specialist. Again, you're not alone. This sadly is happening to too many people. Had poor balance for over 6 months now, not spinning vertigo, but some days of so unbalanced that I can't walk easily without the fear of falling. What rehab exercises can I try that would not harm me? Bear in mind, we don't know the diagnosis, and may help during this period of waiting at home. I understand that I would need to be doing this at my own risk, but I'm desperate to try anything.
So none of the exercises you could do for vestibular system will cause any harm, as long as you're doing things safely and sensibly. So I'll often say to people with some of the exercises I may get them, don't do it standing on a narrow canal towpath, because that's asking for trouble. But the movement you can do within the safety of your home. The VOR is your basic kind of main key one to get started with. So just looking at your thumb, nice and gentle, sitting in your bed or in your armchair, just nice and gently looking at it and turning your head. Imagine your thumb has asked to borrow a huge amount of money and you know it has no intention of giving it back to you. You're staring at it and you mean that no, it's not having all that money. Okay. And if it feels a bit odd, fantastic, that's what we're after. Feeling odd with it, slightly unpleasant, is a good thing. It shows we are on the right lines and we are doing the right thing. Keep practicing. If it feels horrific, we're pushing too hard, too fast, and we need to tone it down. But just keeping your body active and mobile, getting your head moving. It's really, really common with vestibular problems that the neck muscles stiffen up and we start getting a lot more of this movement rather than a nice mobile head. Because the brain's trying to protect you, it's trying to stop you from doing something that feels unpleasant. But you need to get your head mobile. So gentle head movements, your VOR, and just try and maneuver yourself around as much as you can safely do so. Obviously, if there's falls involved, there's potentially a little bit more that we'd need to pay attention to as to what exercises would be appropriate. But sitting exercises, head turns, thumb exercise, your VOR, you can absolutely do those quite safely. You might feel a little bit wobbly after for a short time, so just have a bit of a rest if you're feeling that way. But yeah, get your head moving.
Super. I have rightly or wrongly advised members in the past about walking, saying, well, what a great thing to do if you've got a partner or a loved one or just a friend who you can slowly walk with, who they're holding your hand or your arm and being there sort of to give you that confidence. Because I know one of the big things is I'm going to fall over. And the older we get, the less that's a good idea. So my recommendation is what a great excuse for two of you to go for a very slow walk and a very short slow walk to begin with, till you get your confidence.
As long as it's done safely and sensibly. I mean, if needs be, walking and using the poles just to give that bit of confidence and that extra bit of stability, if you are safe to do so, fantastic. If that means you're more likely to be walking safely than not walking at all, absolutely. But it's all about doing everything safely and sensibly. What we don't want to do is, for example, an elderly and slightly frail couple, and one of them's off balance and the other one's got severe arthritis and much smaller. We don't want one person to fall and to take the other one with them.
No.
So it is doing things safely and sensibly. But the more you're able to move safely, keep doing so. Don't avoid everything.
Yeah. Super. Just a quick, I'm going to hand over to Claire to read through some of the chat questions now. Somebody did put the hand up earlier to ask a question, and we will, once we've read the chat questions, we will do one last sort of round robin to see if anyone wants to put the hand up and ask another question. So I'm going to hand over to you, Claire. It's all yours.
Okay, so First question from Rosie. She's had a few horrendous months of Meniere's and triple PD symptoms earlier in the year, but a much better time over the last few months with minimal symptoms. She's near the top of the waiting list for balance rehab. I wonders if it's worth postponing it while she's in a good health patch. No. No,
No,
take it.
take the appointment when it comes while it's there. Just, yeah, take it. Don't miss out because you're thinking, oh, I'm not quite so bad, so I'll not take the spot. Take the appointment.
Yeah, if they teach you how to do it, if it gets worse again, you've got it in
Yeah.
your bag ready.
Yeah, get in the system and yeah, get that information.
Okay, next question from Francis. They had an acute bout of BPPV in October whilst lying down. They had the EPLI on the 2nd of November, and a consultant told them they had profound BPPV and best not to try the EPLI by themselves. They've had monthly calls with the consultant and a clear MRI scan, and had been told that the condition would burn itself out, but it's still affecting them when lying down and turning to the left. It's worsened slightly, although it's not as profound as before the EPLI. From your experience, what can they expect, and will it get better?
So, home EPLIs, first of all, I'm not a fan of. There's the risk that if you do it incorrectly, you shift the crystals from the posterior canal into the horizontal canal. And basically all hell breaks loose. That feels so much worse. It's such a strong stimulus, and it can then make you feel really bad with any head movement. So home EPLI maneuvers, unless it's being done by someone that's been shown how to do it correctly and given lots of training around it, I'm not a fan of home EPLI maneuvers. With regards to it burning itself out,
It can self-resolve
yes,
in
it can
cases,
self-resolve.
can't it?
Sometimes the crystals put themselves back. It doesn't burn itself out. It can self-resolve. So benign paroxysmal positional vertigo. Benign, there's nothing sinister to it. Paroxysmal, it can come and go. Positional, position of the head and the vertigo, obviously the dizziness. So yes, it can self-correct, but if it's still ongoing at this point, you need another EPLI maneuver or other suitable repositioning maneuver. It can take us a few goes sometimes to get the crystals back and for them to stay back. But yeah, if it hasn't been effective, go and see them again or see somebody that will do the EPLI maneuver for you. But home EPLIs, I'm twitchy on.
Next question is from Lawrence. I think it was Lawrence that had the hand up previously. If you're there, Lawrence, do you want to come back on?
Oh,
You're
you're
on
on
mute,
mute,
Lawrence.
Yeah, double
Oh,
up.
there you go.
Yeah, no, the hand was just to try and chime in, just to agree with something Kevin said. I might as well say it briefly when he was talking about, worrying being an extra thing. There's a kind of Buddhist mindfulness concept called the second arrow, where the first arrow is the pain or the condition that you're going through, and then the second arrow is the suffering, which is your kind of take on your worrying and your anxiety around what's going on. And it's a kind of a concept that's there in mindfulness and Buddhism, which is trying to avoid the second arrow, which is certainly something I'm thinking of lately, which is adding more with hypervigilance, or adding more with anxiety, and it's quite a useful concept, I thought. But that was, so no question in the hand, but I've got a few questions in the chat.
Thank you.
Okay, so the question from Lawrence is, I presume it's the same Lawrence, might have more than one. I often get asked about my balance with my acoustic neuroma, which does currently some limitations, but I tend to think dizziness is my biggest symptom. Am I wrong to think of dizziness as separate from balance?
See, and that's the thing with the language that we use. Some people use the word dizziness to mean balance, and some people use the word balance to mean dizziness, and sometimes we keep it completely separate. And I'm sure I'm as guilty as everybody else that sometimes I'll say balance when I mean vestibular. Yeah, but so dizziness is the subjective sensation of that imbalance, but dizziness doesn't necessarily come from imbalance. We can get dizzy from low blood pressure. So when we come up from lying down and we jump up too quickly, blood pressure drops and we feel all floaty light. That is often described as dizziness. it can be, yeah, the real room spinning true vertigo. Yeah, dizziness is part of, or can be part of imbalance, but you can be off balance or imbalanced without dizziness. So it's such a variable word. It's a, yeah, nuance of language.
Question from John Kane. I've used VRT successfully in the past during acute episodes. I've tended to then wait and see and do nothing if I'm symptom free. Is there such a thing as preventative VRT, or does the brain just get used to this being normal, such that the benefit is then reduced if there's a recurrence?
So the vestibular rehab will help retune the vestibular system to as good as we can get it. Once that tuning is done, hopefully it should stay at that level and kind of not be a particular difficulty unless something else comes in and further upsets it, any further damage that's caused, infections or viruses, things like that. There's not preventative vestibular rehab, but the more active and mobile you are, the better for your balance anyway. So you don't need to continue vestibular rehab forevermore. Some people choose to because the movements keep the neck mobile and it gives them that reassurance and that feeling of control, and that's fabulous. I have no issues with that whatsoever. But once kind of things are resolved, just keep active and mobile, keep walking, keep doing sports if you enjoy sports, Tai Chi, yoga, Pilates, whatever you enjoy. Keep active.
Ian, I think again you've touched on this already. With VOR, you've recommended doing it 4 times a day. They want to know if more is better. So if you're just doing 20 seconds when you're making a cup of coffee, would you do 6 times a day if you can cope with that level?
No. You could potentially increase how long you're doing the VOR for. So say go from 20 seconds to 30 to maybe 45. I wouldn't do more times in the day because we don't want to be kind of going into the realms of overstimulating things. If you are the type of person that doesn't naturally like to push things as hard as you can with this type of thing, bring mindfulness in, because generally in those circumstances, the mindfulness is more effective because it gives that brain the chance to just breathe. So we're stimulating it and we're also letting it relax as well, which is really important rather than just constant stimulation.
Message from John Curtis. Quick one, is cycling beneficial? The answer is not if you live in Preston. It's just highly dangerous. But for everybody else, Michaela?
So, yep, cycling can be good. It's all about doing, if you, that particular sport is what you enjoy, fantastic. Do the things that you enjoy doing. It's really, really important. Cycling is an odd one because quite often people tell me it's odd that if I'm walking slowly, I'm really off balance, but when I'm cycling and I'm moving fairly quickly, I'm pretty good. And yeah, that's to do with physics, really. With cycling, obviously, it's the whole safety thing. Make sure you're doing things safely. So if you're particularly off balance, don't be cycling down a really busy road. Wear a helmet. Do sensible things. I know when I can't remember if it was the last time I was giving a presentation, possibly the time before, somebody asked about the legalities of cycling if there was an accident. And potentially, if you are cycling and you cause an accident and you know you have an issue and it would have been an issue, potentially that does open you up to legal ramifications.
Yeah.
So,
Michaela, if I
yeah.
just add from my side, going through it when I daren't go near a bike. Again, it's a bit like knowing when you can do therapy and not therapy. I just got to a stage where I thought, do you know what? Being on a bike might just be possible. But all I did was found the quietest country lane possible, no traffic, no one, always with a helmet. And you laugh, but I had even skateboard, knee pads, and all sorts to begin with. Um, I I would have got them if I could, little kid stabilizers, but they wouldn't fit on my mountain bike. But just take your time, be really careful. Like I say, safety first, and don't rush these things. But I quite agree. The last thing you want to do is go on a road when you're not confident with traffic. I've got to be honest, I avoid main roads like the plague. And I now do 100+ kilometers a week on a mountain bike, but I go nowhere near main roads. Not because of balance, because of crazy lorry drivers that don't see bikes. But sorry about that. And again, I don't wish to hijack. I just want to. I keep forgetting to mention this. We're talking about the complexities of balance. I will put the link for this. This is why Michaela's job is so interesting. That is the balance disorder spectrum. It's fully interactive, but you can see there are so many ways in to balance disorders. This was put together by Professor Ray, who's speaking at the next meeting, and Professor Andrew Hugill, and I'll put the link on there. But this is what makes your job so interesting and difficult, Michaela, isn't it? There's just so many ways in
It
to.
is, and it's not necessarily just one thing that's causing your symptoms. It can be that you're suffering from a few different conditions that are
Yeah.
all adding in. So it's not a nice straightforward one thing, sort out that one thing that solves everything. It's it's a tapestry. There's lots of threads involved. We need to identify what threads are involved, treat each one accordingly. But yeah, so just taking you back to the bike for a moment, is doing things safely and sensibly. Don't go cycling down a canal towpath. Start off in your local park on the paths where it's nice and relatively even, potentially rather than the uneven surfaceness of the grass, but it's somewhere safe and controlled that you can see how you feel and take it from there.
But I urge everyone, try and do these things when you're ready to. I still maybe I'm slightly crazy after everything I've been through, but I still get an extra buzz every time I get on that bike, remembering there was a time when I thought I would never ride again. So it's just so much even more emotionally satisfying to be able to do these things again. But if you don't try, you'll never know. But try it safely. But just go for it. Walk down that path to your gate, go to a shop, go do whatever your challenge is, just try it a little bit because you get such a high from getting back to doing things that were once taken for granted and normal. So sorry, I'm shutting up again. Back to you,
Can't
Claire.
help yourself, can you?
No,
In a
no.
lovely way. Okay. Question from Francis, who is lucky enough to go boating across the channel for a month each year, and they also want to get back into the kayak. Is this likely to bring on an attack or make their vertigo worse? No condition.
Yeah,
Sorry.
so without knowing the condition, that's a very, very difficult one to answer. Obviously, safety, the life jackets and all these kinds of things, don't go and do it by yourself. Go and make sure people are around you that know what difficulties you potentially may have so they can keep an extra eye on you. But yeah, unfortunately, without knowing a bit more information, that's a really difficult one to answer.
And another one from the chat, which is my personal favourite because I think this is from Abby, who I met in clinic this week, and she must be new to the group. She's got a diagnosis of fibromyalgia with FND and triple PD. So she's struggling with exercise, but she is managing to do cycling, dog walking. She's been on the whole CBT antidepressants journey over the last 10 years, and she's currently waiting for vestibular rehab. What's the best things she can be doing? Obviously, given very small amount of information you've got, that can help her. And especially she's working full time and she's only 33.
So working full time, depending on the job, depends on what difficulties that might be bringing into the situation. So where possible, pacing yourself throughout your working day rather than necessarily starting at 9, keep going until lunchtime, eating at your desk, and then carry on. Try and take lots of little breaks as best as you can. But again, doing the VOR, moving little and often as much as you can, depending on abilities of physical movement and mobility. Things like Tai Chi, Pilates, fabulous. It depends on what physically you're able to do within the fibromyalgia and just gently easing yourself into things. But yeah, good guided VR and you'll get there.
And
A lot of
we
hard
will get
work.
there in Wouldn't like to say, but we'll be there.
Good.
Okay, Kevin, where are we up to?
I've got another question. I've only found the other one, then we can throw it out to the audience and anyone wants to ask a question. Yvonne mentioned she's got triple PD. Symptoms increase when I wear my hearing aids. Is this because my brain is trying to adjust to something else?
That's an interesting one. Often I've found people anecdotally that when they start wearing hearing aids, they feel better because the brain has more capacity to deal with dealing with the balance side of things itself. Triple PD, it might be more of kind of the brain having a bit more capacity to focus more on the balance. Now it's not being distracted by trying to focus so much on trying to follow what's being said.
Yeah,
That's
it's
not
weird. I tell you, even to this day, if I start getting some loud noises going on around me, it kind of not disturbs me in a major way, but it disturbs my mind. It's like I can't tolerate all the. I've only got one ear that works anyway, but it just seems to occupy my brain and becomes distracting when I want to think about other things. I don't know. It's very, like I say, very odd, isn't it, that one?
sometimes it can be that the brain's kind of attached a very strong emotional response to a outside factor, and it's an incorrect attachment. So say you've had a very bad experience, for example, dealing with someone that's been wearing a bright yellow shirt. And then at a later date, you see someone just randomly walk past you in the street, bright yellow shirt, and you have an emotional response of, I'm really upset. I don't know why I'm feeling so frightened. Because the brain's made a completely subconscious connection between that emotion, that strong emotional response to something that was there at the time, but wasn't necessarily actually the cause. That whether that's playing a part in that experience, I couldn't say, but yeah, that's just a slightly more unusual one.
We had a similar situation with a patient. He'd had his initial vertigo attack in a car, which must have been terrifying, but pulled over. It was vestibular neuritis, so he didn't really have that afterwards. But every time he went in a car, he's like, "No, it's making me dizzy again." And it was turning out it was panic attack. So he was bringing on similar symptoms, but wasn't actually the same as the dizziness that he'd had. And it's that association. But once we got to work through that, be a passenger in a car, be a passenger in the front seat of the car, and then very slow journeys in a car park to make his brain realise it wasn't the car making him actually dizzy again.
Yeah, and this is where the different psychological techniques can be really helpful in finding the right one that suits that person. So whether it's CBT, whether it's NLP, clinical hypnotherapy, generalized counseling, it's finding the right method for the right person. But yeah, it's a quirk of how the brain works.
Super. May I say now, because we've overran, is anyone out there, if they've got a question, can they physically put the hand up or use the Zoom hand up and we'll come to you? I saw Andy first. I think you've got your hand up. If you can unmute and ask your question. That's it. No? No? Oh, you've not put your hand up. Lawrence has, so we'll go to Lawrence. There you go, Lawrence.
Thank you. Yeah, had some VOR. I'm just trying to find the notes from it. But one of the ones I was given was heel raises, which are easy enough, but toe raises, I haven't been quite sure how to approach them. Normally I find if I'm raising my toes and going onto my heels, I sort of need to hold on to something. I wondered if heel raises and toe raises were often tacked onto VOR, and if you've got any advice about doing the toe raises specifically.
That specifically isn't an exercise I've tended to give to people. It's when I'm dealing with my vestibular rehab, I'm always looking at what kind of activities people are doing in their normal daily activities and aiming to get things that way, so more functionally as close to what they need as possible. there's not a huge amount that I can think of, particularly in normal daily life, where you'd have your weight fully on your heel rather than having your feet flat.
It may have
Potentially
just been tailored from the fact that I've got I tend to pronate my foot, so he may have just given me that for another thing that's already going on that kind of
yeah,
affects my
potentially.
motion.
Sometimes I'll work with uneven or softer ground, but I always try and have the feet fairly flat, as I mentioned before about the posture, having the shoulders over the hips over the ankles, and feeling the weight distribution on your feet to make sure you're not inadvertently putting yourself off balance because of the incorrect weight distribution. But that's something you probably need to speak to your provider about, kind of what they're aiming on that, and to help you with that one,
Thanks,
unfortunately.
thanks, Lawrence. I've got another couple. Janine, can you unmute and ask your question, please?
Yes. Hello, Michaela.
Yeah.
This is Janine from Germany. I have a question. I saw the balance disorder spectrum that Kevin posted again, and I went to a neurologist who, by just examining me, could find out which tests will show what is wrong, and he directed or prioritized my treatment plan. And I wonder whether there is some kind of overview where you can see, like with these and these test results, that makes sense, so that I can prioritize the rest bits of pieces that these GPs found based on the direction of my neurologist.
Yeah, there's not that I can think of particularly offhand what you're describing. The key thing with any kind of balance issue, often it's not the tests that are going to fully tell us what's wrong. It's a case of having a really, really good history being taken to try and take into account all the different threads that might be involved, because you don't want to undergo tests for every single thing that they could possibly come up with, because you don't want to go through unpleasant tests that you don't need to. It takes a lot of time, a lot of resources, and it's exceedingly inefficient. When there's a really good history taken, the correct, or as many of the threads that are potentially involved are identified, then the correct tests to look at those threads can be requested. And it's more of a kind of gathering all those jigsaw pieces and putting all those pieces together as a kind of a whole, rather than just looking at one bit. But there's not anything that's kind of going to necessarily just put all the tests together for you.
Okay, because my GPs wonder how he did that. He did twist the whole treatment plan, and I'm feeling better because I feel that I'm walking in the right way.
Yeah.
And I know that I have more test results out of these testing than he expected, but I wanted to have like these bits and pieces. And if there's nothing like an overview that exists, I need to consult him again.
Yeah, this is the kind of the really good way of showing how important it is to see someone that knows and their interest in speciality is in balance. Because often when people see someone that isn't their particular speciality or their interest, they look just at one part of the system and not take into account all the other things. As I said right at the very beginning of my slideshow, balance isn't just your vestibular system, it's your visual system, it's your full musculoskeletal system, it's your brain. And being able to get key bits of information for covering all of those things, the symptoms that you're getting, working out which of those threads are involved, is actually what tells us what's going on. And then we'll know what we need to do about it, because we know what threads we're dealing with.
Thank you very much.
Thank you, Janine. Then we've got a member. I refused to call you iPad, but that's the name we've got. So you can unmute and let us know who you are.
It's Conchita Costar, because I was on the but now I'm probably on the iPad, yeah. And it's Conchita. That might be a bit of a frivolous question, but I got the PPPD for the last 4 years. And I've been to UCHL, University College. I did test again. And the referral to vestibular therapy they kind of, I think they told me I'm too well to have that on the national health. You know what I mean? My results are too good for me to waste their time, in other words, to get the resources of the National Health for Vestibular Therapy. Is that correct? Is that something that you would agree with? Yeah, because when they do my test, I'm well. Yeah, I'm well. I don't have any balance problems whilst I do the test and all that. But every day I live with that, and it's really I got a lot of anxiety and all this and all that. And I just wonder whether I am too well to get treatment. Apart from the citalopram, they gave me citalopram, which I left because it was horrendous, the side effects.
Yeah.
Michaela, can I just give the unprofessional response?
Yeah, while I come up with one that's professional.
Yeah, it reminds me very much of a member, this is 3 or 4 years ago, who went on a holiday on a coach. She couldn't get off the coach at the time when they arrived somewhere. She just wasn't having a good time at all. She spent 6, 7 hours sitting on a coach while everyone else went around this place. She saw a GP a week later, and the GP said, "You just need to learn to get on with it." That's a little bit more extreme, but my point there is no, you don't. You are an expert in your own body. Only you know when something is becoming a problem with your life. And if it's a problem with your life and you think that's not right, I just urge you to keep on going and fight to get people who will help you come to terms with that. I know the difficulty, the professionals will say, well, it depends, you may never get over certain things. But I just think we're experts and we generally know if something is a problem that's getting in the way of our everyday life. So,
Right.
and remember that I think they've even said it officially last year when they were trying to juggle spin plates with the NHS, you can go and get other opinions. If you can get another opinion. That's enough of my unprofessional approach, which is just fight for your rights and don't ever give up and don't be fobbed off. If anyone in the NHS says you're too well for us to treat us, that could be another reason to say we want to get you off our long list. I'm very skeptical these days. Back to the professional.
Because to be honest, I think, well, I can live my life. I go swimming, I can do it. But let's say about 4 o'clock in an hour's time, I had it. I cannot do another thing. I'm so exhausted. I used to love for many years, I used to go, I know, again, frivolous, but I love opera. And now I cannot go to the opera. And used to be such a part of my life, and it's gone. And that's not right, is it?
Don't discount doing things that you enjoy doing, that they're frivolous. They're not. Life is there to be lived.
I
to be
can't do
enjoyed.
it. It's too much.
Exactly. So that doesn't mean that things are normal. If you're not able to do the things that you enjoy doing and that you were able to do before, hopefully there's something that we can do about it, even if the tests are normal or you don't reach whatever kind of marker they've set for not being well enough and therefore needing treatment. Keep pushing. Try and if who you're seeing isn't able to provide you the help that you're needing, look elsewhere.
Okay.
Don't give up just because that particular place or individual isn't able to help you for whatever reason they're not able. Balance is and vestibular, see, I'm interchanging balance and vestibular. Vestibular issues is a very specialist niche in the market. I'm told by many people it's a very niche thing. But it's so common. But there's so few of us, certainly in the past, that have had any training or understanding of balance, and that is improving. I've done this for coming up for 28 years, which I don't know quite how that's possible, but in that time it's moved on massively, and there's so much more interest. there are more of us training to be able to help you and to know what's going on and know what we need to do about it. There's still not anywhere near enough of us, but there are a smattering of us around, and it's a case of finding a way to find us. And if the person that you've seen either doesn't have the knowledge, the interest, the speciality, the support that they need to be able to provide that service to you, there are others. Keep looking.
Thank you.
Brilliant. Thank you very much.
Thank you.
Last question now is Sarah. Yes, Sarah, can you unmute, please, and ask your question? No, can't hear you.
There we go.
Yes, go
Yeah.
ahead.
Hello.
Go
Hello.
ahead.
Hello. Hi. Yes, I've been on radio silence for a while since I've joined because I'm just sort of getting over grieving over sort of years lost because I've been through this for years. I have triple PD, that's what I've been diagnosed with, and vestibular migraines. And I've at last just started rehab at Peterborough Hospital, which I haven't had to pay for, which is great because I've spent thousands on getting diagnosed and stuff in the end privately. This is a really silly question, but I need to, because starting the therapy, so I'm doing the head movements, I'm doing the figure of 8 and moving my head. I know you've said about doing the thumb and catching the ball and all this sort of thing. It's going to be boring, but hey, silly question, but see, I wear varifocals, right? So if I'm looking at my thumb, I can't do it with I have to, yeah. So with the movement though, with the corridors of glasses, I'm having trouble with it, and especially with the ball catching, because also with the background, you've got a busy background as you're doing it, and so it's fairly uncomfortable. And I know we're supposed to sort of be uncomfortable, but some of the exercises I've been told to do are sort of up to a minute, and like catching the ball is 4 minutes, and it's with very focused, so I can't catch the ball without I'm at a certain age now. I didn't have to wear glasses till I was 51. And since I'm 51 and now I'm approaching 60, it's sort of like, I need to wear my glasses. So it's a bit challenging. What can I do? Is there any advice that you could?
It may be that you're doing too much all at once.
Yeah.
So kind of focusing on just a couple of the exercises and get that really consistent and kind of mastered. Varifocals is an interesting one with balance issues, with vestibular issues. It is quite a known thing that going on to varifocals once you've already got a vestibular issue, the brain finds it a lot more difficult to adjust to the varifocals.
Yeah.
If you've had varifocals for quite a period of time before any vestibular issue, it doesn't seem to be such a difficult thing.
Right, that figures them, because I've only had varifocals for 3 years now, and I had the vestibular issue since my late 40s. And the reason it was is because, funny enough, I worked in an optician and had to have them because of looking at, and they didn't like me doing this all the time, and especially doing this. And so I was on to the varifocals, but that doesn't apply now because I don't work, because in the end it took over my work and I was off sick a lot, and so I'm not working, unfortunately. So with sort of like the thumb business, so would I be better using my single vision glasses then and just and do it rather than?
More than likely.
Right, okay, that's an easy answer then. I'll go and get some single vision glasses.
So it may be worth considering separate glasses for reading and for distance. Some people do perfectly well with bifocals.
Yeah.
The varifocals, because it's such kind of narrow strips of vision, and that change in your kind of more peripheral vision, how your brain's perceiving that, can make it challenging when there's a vestibular issue already there.
Right, okay. So good question. Right, okay, good. I think I'd prefer to go back to single vision actually then. And it's yeah, I know I am. So yeah, thank you. Simple question, but just, something to.
But there's not any such thing as a silly or a stupid question, because it's a perfectly sensible question.
Yeah. Okay. Thank you very
Thank
much.
you. Thanks a lot. That's it, folks. I think ever so sorry, we're out of time now. We've actually broken all possible records for meetings and approaching 2.5 hours. So thanks so much, Michaela. It just shows the importance of this area that you've worked in for so many years. I don't believe, because I think you would have had to start at the age of 12 to do that many years. But thanks ever so much. Thanks everyone for being on the meeting, because remember, the group is you. This is what makes it work. Everyone's sharing what's going on, what's happening. Michaela, another brilliant piece of work. Claire, thank you so much, because your day job as an audiologist for the Royal Preston as well is brilliant. So all of it is remind you, August the 15th, next meeting is the wonderful Professor Peter Ray, who is past president of the Royal Society of Medicine and a huge supporter of the group. He will have the latest on what's happening treatment-wise and what is the outlook for us all. How will artificial intelligence help us balance again is the big question. But thanks so much for everyone coming. You can all unmute now. You can cheer. You can even swear if you want. I can edit it out. But have a great time. And remember what we're saying, marathon, not a sprint, and you are going to get lots better. We all get to a better place. Go and have a happy life. And I'll see quite a few of you again in a couple of months. Thanks ever so much.
Thank you.
Nice to
Thank
see you all.
Thank you.
Thank you. See you again. Cheers.
Thank you.
Bye-bye.
Thanks for all the volunteers. You're all heroes.
Bye.